Hello, everyone. My name is Dr. Lisa Kaltakshan, and I'm excited to have you all here. Today, I will be discussing the salmonella outbreak at Greenfield Farms through the lens of the One Health approach. We'll explore the interconnected roles of humans, animals, and the environment in this outbreak and discuss actionable solutions to prevent future occurrences. Let's get started. So, this case highlights the interconnectedness of human, animal, and environmental health. Given that salmonella is a significant public health concern, understanding its transmission pathways through contaminated food, water, and direct animal contact is essential. By identifying risk factors and implementing targeted preventative strategies, such as improved biosecurity, measures proper waste management and enhance public awareness, we can effectively mitigate outbreaks and decrease the overall burden of foodborne illnesses on the community. So in our next slide, we're going to be going over our objectives. So our goal today is to identify the pathways of salmonella transmission, to assess the roles of humans, animals, and the environment in the outbreak, to outline key stakeholders and their responsibilities, and lastly, to propose an action plan to mitigate and prevent future outbreaks. So let's begin by mapping the potential transmission pathways. So transmission pathways. Pathways of Salmonella transmission. Salmonella can spread through multiple interconnected routes, making it a complex public health concern. The primary transmission pathways in this outbreak include foodborne transmission, which is consumption of unpasteurized milk from infected dairy cows and contaminated poultry products, which likely carried Salmonella enterica, which is a major source of the infection. Inadequate food safety measures, such as improper handling and lack of pasteurization, increase the risk of contamination. There's also waterborne transmission. The application of untreated manure as fertilizer, combined with heavy rainfall, led to runoff contaminating the nearby stream. This stream was a crucial water source for irrigation and recreational activities, increasing exposure among farm workers and local residents. We also have animal to human transmission. This is where direct exposure to infected animals, particularly cows with mastitis and chickens with lesions from salmonella, facilitated the spread of bacteria through contact with contaminated feces, milk, and meat. Lastly, we have person-to-person transmission, where someone has poor hygiene practices, such as inadequate hand washing after handling animals or contaminated materials. This contributed to secondary infections among farm workers, their families, and their community members. So, the roles of humans, animals, and the environment. Understanding the interactions between humans, animals, and the environment is a key to controlling the outbreak. So, us humans, we can act as both carriers and amplifiers of salmonella, consuming contaminated food and unknowingly spreading the infection within households, workplaces, and healthcare settings. From farmers in direct contact with animals, they have a heightened risk. So animals serve as reservoirs for salmonella with infected cows and poultry, contributing to significantly to transmission through milk, eggs, and meat. The bacteria can also persist in animal feces, contaminating soil and water sources. Lastly, environment plays a critical role in sustaining and facilitating the spread of salmonella, as contaminated water sources, soil, and farm waste contribute to indirect exposure and reinfection cycles. So by examining these transmission pathways, we can identify targeted interventions to control the outbreak and prevent future occurrences. Now that we understand how salmonella spread within greenfield farms, let's move on to identifying the key stakeholders responsible for managing and resolving the crisis. Okay, so stakeholder engagement. So key stakeholders and their roles. They can be public health officials and play a crucial role in conducting epidemiological investigations, identifying the source of infection, tracking cases, and issuing public health advisories to minimize further transmission. They also coordinate responses with hospitals, laboratories, and local governments. Number two, veterinarians, who are responsible for monitoring and treating infected livestock, ensuring that dairy and poultry products meet food safety standards. They also assist in identifying asymptomatic carriers among animals and advising farmers on the best biosecurity practices. Number three, farm owners and workers. They can implement safe farming practices, proper sanitation, and hygiene protocols to prevent contamination of milk, poultry, and crops. Training farm employees on proper waste disposal and hand hygiene is essential in limiting the spread of salmonella. For environmental agencies, they assess the impact of farm runoff on water sources and develop strategies to mitigate contamination. They work to implement sustainable water management practices, enforce regulations on manure disposal, and ensure irrigation of water meets safety standards. Number five, community members. Community members play a critical role by following hygiene recommendations, avoiding the consumption of unpasteurized dairy products, and promptly reporting symptoms of illness. Community awareness campaigns can help reduce risky behaviors and promote food safety. So here we're going over the collaboration for outbreak management. A coordinated response among stakeholders is essential to contain and mitigate the outbreak efficiently. Timely data sharing between medical professionals, veterinarians, farmers, and environmental agencies ensures that preventative measures are effectively implemented. Strengthening food regulations, improving waste management practices, and enhancing disease surveillance are key components of long-term prevention. By working together, these stakeholders can prevent future outbreaks and protect public health. So now let's move on to the proposed action plan for controlling and preventing future outbreaks. So for our action plan, immediately we can issue a recall on unpasteurized dairy products from greenfield farms. We can implement a temporary boil water advisory for affected communities and treat infected patients with appropriate medical care. For ongoing improvement, we can seek feedback, reflect on performance, explore new techniques, set personal goals, and iterate and adapt. In the community, we can educate residents on safe food handling and hygiene. We can establish routine water quality monitoring to detect contamination early, and we can encourage community engagement by creating local food safety committees to report and monitor potential health risks. For environmental control within our action plan, we can introduce controlled manure disposal systems to reduce runoff risk, and we can implement vegetative buffer zones to limit contamination of water sources. So, sustaining long-term prevention through One Health. The One Health approach emphasizes the interconnectedness of human, animal, and environmental health, as we have been saying earlier. So ensuring a sustainable and integrated strategy for outbreak prevention by combining improved agricultural practices, strengthened public health policies, and environmental engagement, greenfield farms and similar agricultural facilities can reduce the likelihood of future outbreaks while safeguarding both food safety and community health. So the reflection and the conclusion, the benefits and challenges of One Health. So the benefits include it encourages interdisciplinary collaboration between human, veterinary, and environmental health professionals. It enhances disease surveillance and response strategies. It provides long-term solution to prevent recurrent outbreaks. Some of the challenges One Health approach might face are it requires effective communication and coordination among multiple stakeholders. The implementation of preventative measures can be costly and require policy changes, and the community engagement and behavior changes take time to develop. So, final thoughts on this presentation is the salmonella outbreak at Greenfield Farms highlights the critical connection between human, animal, and environmental health, reinforcing the need for a One Health approach to managing foodborne illnesses. The case demonstrates how contamination in one area, whether through infected livestock, unsafe food handling, or environmental pollution, can rapidly impact public health. To prevent future outbreaks, it is essential to enhance food safety regulations, improve water quality monitoring, and implement stricter farm management protocols. Educating farmers, workers, and community members about hygiene, biosecurity measures, and safe food consumption will further reduce the risk of disease transmission. Additionally, fostering collaboration among public health officials, veterinarians, farmers, and environmental agencies ensures a coordinated and effective response to future health threats. By applying sustainable practices and strengthening disease surveillance, we can protect both agricultural integrity and public health. Thank you for your time and attention. We are happy to take any questions. Thank you. And here is my contact. Here are my references.